everyone, and welcome back to the Mommy and Baby Show. This is your host, Mercy Tetu, the host to the most. And today we're on episode 2. We'll be looking at the final weeks of pregnancy. Hoping you saw last week's episode whereby we were discussing about having discovered you're pregnant and what comes after that. So if you haven't watched it, please make a point of going back and watching that episode.
I'm Nolina Nyango, a nurse at RFH Kiambu Road. I've been here for 2.5 years. I'll be taking you through the final stages of labor. I usually like working with the pregnant mothers throughout their pregnancy journey.
So as we get to the final stages of pregnancy, there are some changes that as a mom you will go through. So what are these changes that I should be expecting, and what are the normal ones, and what are those that will make me know that I need to seek medical attention?
Okay. Basically, during the final stages of labor, that is 36 to 40 weeks, the body usually undergoes through changes. And the changes may be normal versus red flags, of which the red flags are like warning signs, which may need medical attention.
So what are the normal ones that every pregnant woman goes through?
Okay, for the normal signs, there are several. The first one, we'll talk about the pelvic pressure. This is usually caused by the baby dropping. It is called lightening. The baby usually drops in the pelvis, leading to the pressure, which causes the abdominal discomfort. That is usually a normal sign, no worries. The second one, we usually call it the Braxton Hicks. The Braxton Hicks are the normal irregular contractions the mother will experience. They are not too painful, they are just manageable. Another normal sign is the frequency in urination. This is usually caused by the pressure exerted in the bladder when the baby presses the pelvis. Yeah, so the number of times you might visit the latrine for urination is more than usual. Yes. Another normal sign is increase in vaginal discharge. The discharge might be clear or whitish in color. Yes. The final normal sign is leakage of colostrum. So those are the normal changes in the final stages of pregnancy. And it usually does not mean that the mother will go through the labor immediately. It's just a preparation for the labor process.
So all these are normal signs. So even with the Braxton Hicks, I should not be worried that this is the baby, I'm going into labor. It's just something that usually comes and goes. Okay, sweet. So we've discussed the normal changes to expect. What are some of the warning signs that this should not be happening?
Red signs, we usually call them like warning signs that when a pregnant woman sees, she should seek medical attention. There are several of them. The first warning sign is when you have severe headache with blurry vision. You'll need to seek medical advice because it might be a sign of preeclampsia. The second one, when you see vaginal bleeding or spotting, you'll need to seek medical advice. The third warning sign is reduced fetal movement. When a pregnant mother realizes that the normal pattern of the fetal movement is decreased, she should visit the hospital immediately. The fourth one is the leakage of the liquor, which is the drainage of amniotic fluid. If the amniotic fluid comes out, you should also visit the facility immediately. The fifth one is when the pregnant woman experiences severe abdominal pains. That is usually not normal because the pain should be mild but not severe. So when the pregnant lady experiences severe abdominal pain, she should visit the health facility immediately for medical attention.
Okay.
The sixth one is when you notice swelling on the face, on the hands, and on the feet. You should visit the health facility immediately to rule out any complications.
Okay, so other than those discomforts or routine expectations or what you're supposed to go through, what should you also expect when you're going for your last few clinics?
During your last prenatal clinic visits, there are usually some assessment that we usually do. which include monitoring maternal vitals, which include the blood pressure, can monitor the heart rate of the mother, the oxygen concentration, and the temperatures to rule out fevers, blood pressure to rule out like the preeclampsia. Yes.
Just to, before you move on, when you say to rule out preeclampsia, I don't know if I'm saying it right, what is that?
Okay, preeclampsia is usually caused by persistent high BPs during pregnancy, and this usually leads to convulsions, which are called eclampsia, if they are not managed. Also in the last clinics, you'll do some lab works, which will include full hemogram. You'll have to consider checking the hemoglobin level of the mother, and also you'll have to check the platelets. You'll also do some urinalysis. Urinalysis, we will rule out if there are infection. We will rule out if there are ketones and proteins, which are a sign of preeclampsia. And we will also rule out glucose in the urine, which usually brings about gestational diabetes.
When you say you're checking for proteins and you said something with a K.
The ketones?
Yes.
Yes.
So me as a new, so when I go to the clinic, what I'm expecting is that for you to check this means you'll be drawing out blood?
Okay, for the ketones and proteins, we usually collect urine sample.
Yes.
We do a urinalysis test, and that's where we will find if the urine has ketones, proteins, glucose, and also infections. We usually also send the mother to the ultrasound. The ultrasound will confirm the weight of the baby according to the gestation, if the amount of amniotic fluid is adequate, and also if the baby has any cord around the neck. In the last prenatal clinics, we also monitor the fetal well-being. We monitor the fetal heart rate, and also we ask the mom if the fetus is active in movements and patterns. Yes.
So you've mentioned that you ask the mom if the fetus is still active, and guessing that means the kicks.
Yes, the kicks.
So I know I have this question, but just in that last clinic, is it true that once I'm close to the end or close to giving birth, the kicks will reduce?
Towards the final end of the pregnancy, the kicks should not reduce. They usually remain the same throughout up to delivery.
All right, so a mom is now just about to give birth, and she's now in the 3rd trimester. How can she better prepare mentally that now I'm about to give birth? What would you advise that pregnant mom on how to mentally prepare?
The mother at the final stages of pregnancy can prepare herself mentally in so many ways. She can educate herself about birth process. They can educate themselves by attending birth classes. We usually offer them at our facility. They can also have positive minds towards childbearing process. The mother can also practice deep breathing techniques, which usually causes relaxation to carry through. Mentally, the mother can also avoid negativity and avoid people with negative issues concerning the childbirth process. The mother should prepare mentally for the childbirth outcome, because the childbirth process is usually unpredictable. She may try the normal delivery, but can end up for C-section.
Yes.
Yeah. The mother should also have a birth plan.
So when you say that a mom should have a birth plan, what exactly do you mean?
Birth plan is the preparedness of the mother for the baby she's expecting. She should be ready during delivery. Birth plan include the choice of hospital for delivery and the midwife, the birth companion, the person who will accompany her during delivery, be it spouse, relative. The mother should have a checklist that she will be needing to know if she has packed everything that is expected of her during delivery. The mother should have the bag ready and packed. The mother should also have transport for to and fro during delivery.
Okay, so there are many myths surrounding the last weeks of pregnancy, and we're not really sure whether this is true or not because everyone has an opinion out there. Can you maybe share some of the myths that you've had in your line of work? Because I'm sure you see so many pregnant women, they have so many, I will not say ridiculous. When I mention ridiculous, I'm talking about myself. I remember I was asking so many questions because I'd had so many things. So what are the most common myths you've had about these last weeks of pregnancy?
Mercies, you know, the myths are false ideas.
Yes.
Or beliefs people usually give out or share.
Yes.
The most common myth people usually talk about is the shape of the belly, that when the belly is down or up, it's a boy or a girl. That's a myth because the shape of the abdomen does not determine the gender. It's just because of the body structure, the way the baby is lying, but not necessarily the gender of the baby. Yes.
I've heard that one a lot.
Yeah. Another myth people usually say is when you walk or exercise, it usually makes someone to go into labor. That's not true because labor is a natural process. It usually comes on its own when the right time reaches.
Okay. I have a question on that because I remember I was past my due date that I was given. So they told me to bring the labor closer, I should walk more. So does that help in any way if you're past your due date, the walking?
The walking more just helps the labor process, but not necessarily bringing the labor.
Okay.
It helps with the pelvic muscles to adapt for the labor process. Yes.
Okay.
Another myth people usually say is spicy foods, taking okra water, eating pineapple, usually brings labor. That's not true because, as I said, like labor is just a natural process. Another myth people usually say is the second and third pregnancy, the labor process is not that painful or it doesn't take long. The fact is that labor is never predicted. It might take long because all pregnancy are different. It's not all about first or second or third pregnancy. Another myth people usually say is that the exact expected delivery date written on your antenatal booklet is the exact date that you will give birth. That is not true because sometimes labor can come more than 2 weeks or less than 2 weeks. And that's all about the myths that people usually talk about pregnancies.
Okay. I have one, I had a few myths of my own I wanted you to debunk, but I think you've mentioned them and you've explained them so well. So you said even if the bump, because the baby has to drop. So, and then that does not necessarily mean labor is close to starting, right? It just means the baby has dropped, but labor can be close or labor can be far. Okay, then I also have another one. They say that if you have sex in the last few weeks, it will trigger labor. Is that true?
When the baby drops, the pelvis usually have more pressure, but it does not necessarily mean that labor will start. It's just preparing the pelvis for labor process, but not necessarily for the start of labor. Yes. And for the sex, it does not induce labor.
So telling moms out there that if you have sex, your labor will start is a complete myth.
Yeah, it's a myth. It doesn't start labor because labor is just a natural process that starts on its own.
Okay.
Yes.
That is really nice. So as a partner out there helping your wife, your girlfriend to give birth, how can they best give their support during these last few months?
Okay, the partner, is it a relative, a spouse, or anyone?
Any can be any, because you might be pregnant and you're still at home, so you're close to your mom. You could be married with your husband, you could be with your boyfriend, anyone.
Okay.
Anyone who is supporting you.
The partner can support you in many ways. Let's first talk about emotional support. The emotional support can include active listening. He or she should be there, and listen actively to whatever you say. Any complaints you have, like pain. Emotionally, she can also support you with reassurance. This at least will allay your anxiety about childbirth process. You just be relaxed.
Yes.
The partner can also give you physical support. The physical support include doing the house chores for you, and also the massage, back rubbings. At least you'll feel relaxed.
That sounds very nice.
The partner should also accompany you during the last prenatal visits, so that both of you can be educated about signs of true labor. So when you are at home and you have the signs, he can be able to help. The partner can also support you in packing your bag so that you cannot miss out anything that needs to be packed in your checklist.
Okay, so maybe you can help me as I ask this question. I want to find out, are there specific routines that will help you with preparing for labor? Specific like exercise routines, like maybe yoga, maybe there are some you can share with us?
Okay, pregnant mothers are usually advised to just do light exercises, not the heavy ones. They can walk around daily. That is safe in pregnancy. It will not induce labor, but at least it will prepare the pelvic muscles for labor.
Okay.
They are also advised to do squatting. If need be, they can support themselves using a wall or a chair for the squats. The mother can also use the birthing balls. You just sit on the ball and you bounce gently. It usually helps in preparation of labor and descent of the baby. The pregnant mothers can also do the yogas. It usually helps in preparation of the labor process.
So as we come to our last question, what advice can you give to moms out there as to how they can stay comfortable and healthy during these last few weeks of pregnancy?
Comfort. There is sleep support for the pregnant mothers, which might include using the pregnancy pillows. It usually supports the belly and the knees, so the mothers usually feel at least they are comfortable. They should also avoid lying on the back and rather maintain lying on the left side to improve the blood circulation in their body. For the pregnant mothers with heartburn, they should at least raise the head while lying to avoid the heartburn and also to ease the breathing. They should also manage swelling of the lower feet by elevating them while sleeping. They can take a pillow and put them under their feet while sleeping so that it can be elevated. During this period, they should also just wear loose clothes. They should not wear something tight, at least so that they can be comfortable. For healthy tips, the pregnant mothers should maintain frequent hydration. They should also minimize the workload at home. They should just do the minimal tasks. They should also maintain a balanced diet, foods rich in iron, proteins, and calcium. They should avoid the processed foods because they usually bring the heartburn. And also they should avoid spicy food to prevent heartburn.
So I just remembered one myth that you mentioned right now about the heartburn. Is it true, I'm sorry I'm taking us back, but
No
is
problem.
it true that if I have heartburn, then I know my baby will have lots of hair? Because sometimes it's okay, let me have this heartburn, my child will have this amazing, beautiful hair. Is that true?
That's not true. It's just a myth. Yeah, because baby hair and cravings, they are not related.
Not related. Okay, all right.
The mother should also maintain taking the supplements she has been taking throughout the pregnancy till delivery period. The pregnant mother should also avoid sitting or standing for too long to avoid swelling. She should be at least walking around.
Okay, I guess that is all we have for the questions I had prepared or we had prepared. Unless you want to share something that is very important to the moms who are watching, what is the key takeaway you can tell them about these final months of pregnancy?
In conclusion, the final stages in pregnancy are usually crucial. So I'll advise the pregnant mothers during this period to eat well, have enough rest, always visit the health facility
Yes.
in case of the red signs that we talked earlier about.
Yes.
In RFH Kiambu Road, we usually walk with you throughout the whole journey till you receive your bundle of joy successfully.
Thank you so much, Nolene, for being here. That concludes what we had for today, and we really appreciate your time, and you are most welcome any other time.
Thank you so much for hosting me.
I hope you had a good time. Anyway, that's it for today. I hope you have learned, and also, as she has mentioned, if you RFH Kiambu Road walks with you throughout the pregnancy journey. So if you just discovered you're pregnant, regardless if you're among the last few weeks of your pregnancy, you still have time. You can walk in. You'll have someone. You can have Nolene if you want to walk you through this pregnancy journey. And until next time, it's been a pleasure. Don't forget, subscribe, like, and share with all your friends. Until next time, bye-bye.